Hi, and welcome to Not So Radical. I'm your host, Peter, and today we're going to do things a little differently. I want to warn you that we're going to be talking about mental health and substance abuse in this video. And on that note, COVID's silent killer. Now, this article by Breitbart, they pull up a tweet by Governor Ron DeSantis, and he took the fatality rate data from the CDC website, and he did some simple math against these and found out the survival rates by age group. Now, basically, if you're 69 or under, your survival rate's 99.5% from COVID. If you're 70 plus, your survival rate drops down to 94.6% to survive COVID. Now, with those survival rates, I understand. I mean, for if your survival rate is 100%, I understand your concern. Anyone would be. But if you're 70 plus, I understand you're quarantining, you're staying home, social distancing, having your groceries delivered, etc., etc. If you're even in the 49 to 60, I understand you're wearing a mask, you're social distancing, you're playing it safe. Hey, that's great. But there's no reason for businesses to be locked down still or half capacity when we were just trying to flatten the curve with that, especially with a virus that isn't as lethal as the media's played it up to be. It's still lethal, don't get me wrong. I'm not saying it isn't. But let's see with this constant state of, I want to say, like uncertainty or confusion of when are we going to return to normalcy? Is there going to be a new normalcy? What's going to happen? What isn't going to happen? But let's see what the long term effect of these lockdowns and social distancing has caused. Hospitals are seeing an uptick in liver disease due to the pandemic. An article at the Kaiser Health News, they said from 2019 to 2020, they're up by 30%. Now we all know with alcohol abuse, its friend, drug abuse, one of the deadliest years in history for U.S. drug abuse. Now from 2018, there were 67,367 deaths, and 2019 there were 70,630 overdoses. Now compare those numbers. It's just under 3,300 new overdoses from last year to from 2018 to 2019, excuse me. But from 2019 to 2020, it's increased. As you see in 2020, the number is 81,230. Now, as you can see from the previous numbers, 70,630, just under 11,000 new overdoses. But it went from almost just over a 3,000 overdose jump to a three times almost 11,000 drug overdose deaths. It's hurting people mentally. It's substance abuse issues are skyrocketing. Mental health issues are skyrocketing. Here's another article. It's from Politico, healthcare. One quarter of young adults contemplated suicide. The young adults between ages of 18 and 24 so they've considered suicide in the past month because of the pandemic. That's a crisis in itself. I say that because I'm a person. I've experienced trauma in my past. I've had my own demons. I'm sure most of us have. And I understand how traumatic at an early age or when you're younger, how so many different things can affect you and traumas and kind of paint a path for your future in a way and hurdles that you're going to have to overcome. I'm not saying that you can't or things will never get better, but I am saying there are things you have to overcome in life that were present in your childhood. But also on that note, not even just younger people with mental health issues. Here's from the CDC. They're talking about substance abuse, suicidal ideation during COVID-19 pandemic. During late June, 40% of U.S. adults were reported struggling with either mental health or substance abuse issues. I mean, why is this not being talked about more? I know personally so many people struggling with many different things, and I hear it all the time, and it's come to a point where the focus needs to stay on the pandemic, get people vaccinated, help whatever you have to do to curve it. If you feel like you need to quarantine, but there's people that are suffering economically, mentally, that the numbers will be way better off if we return to some form of normalcy, but keeping some things in place. And let's be honest, the mask, I've been to so many different places where you wear it to walk in the door and then they don't care. You walk in past two people with the mask on to stand next to 15, 20, 30 other people. So it's more of a choice whether you want to quarantine or don't want to quarantine. But it's come down to just data. If you look at data, a 99.5% survival rate if you're under 69. There's no reason businesses that we were just trying to flatten the curve with should still be closed. There's no reason that people need to get back to that somewhat sense of normalcy, and so they can improve their mental health. And like I said before, I know about trauma. I have my own demons in the past, and if you need someone to talk to, feel free to reach out. Um, Always here, always available. I like to help people. I know what it's like. Sucks when you're alone, but on that note, thank you for listening, and I hope mainstream media starts talking about this more often. It's a serious crisis, and we need to do something about it. And thank you. And if you like the video, please comment, subscribe, let me know what you think or don't agree with. If you don't, let's talk about it in the comments. Until then, have a nice weekend.